Hi there, I'm Andrea Jamieson, and this is Ann Jamieson. We are presenting on published research titled Opioid Use Fueling HIV Transmission Use in an Urban Setting, an Outbreak of HIV Infection Among People Who Inject Drugs, Massachusetts, 2015 to 2018. So first, let's discuss the questions that the study presents to its readers.
The two questions the study presented were how can HIV transmission be lowered and prevented in high-risk communities, and how can identification and intervention within a transmission group stop HIV transmission from occurring? We will see these questions come up throughout the study, and they will both be explored in depth. Now we're going to take a look at some of the vocabulary or acronyms that are vital to understanding this study.
So first, we have PWID, or people who inject drugs. The study defines a person who injects drugs as someone living in Lawrence or Lowell who reported injection drug use within the last 12 months. Second, we have IDU, or injection drug use. This one is, as it sounds, the act of injecting drugs. Third, we have the Massachusetts Department of Public Health, who help monitor health and illness in Massachusetts. HCV stands for hepatitis C virus, a virus that attacks the liver and causes inflammation and is often spread through sharing needles. Next, we have SSP, the Syringe Service Program, where the MDPH provides sterile needles for people who inject drugs, as well as education and connection to help services. They also provide access to Narcan at these programs, an essential medication in treating overdoses. Stakeholders in this study are defined as people who worked with people who inject drugs in Lawrence or Lowell during the study. They are persons who engaged in surveillance, prevention, and helped the treatment community. So next, let's discuss the background of the study to give perspective about the research.
The background of the study discusses the increase of opioid misuse seen in 2011 to 2015 within Lawrence and Lowell, where opioid overdoses doubled the national average within these communities. The usage of fentanyl increased and was seen in many of the cases of opioid misuse in the communities. Hepatitis C virus positive cases dramatically increased prior to 2011, and HIV diagnoses decreased by 68% prior in 2006 to 2014. Urban areas have decent preventative measures, but especially for the homeless population in places like Seattle, 2018 studies showed that the population of injection drug users showed vulnerability to infection and illness. This knowledge helps to demonstrate a need for more comprehensive measures against HIV and infection from injection drug users. Now let's discuss the two methods that researchers used, epidemiology and molecular.
The researchers defined their epidemiological methods as including drug use and sex as a linking. The epidemiological method has been a standard in tying together the way HIV spreads for a long time. They also used molecular to tie genetics being the similar or same as a linking. The POL gene, or polymerase, contains reverse transcriptase, protease, and integrase, the three tools essential to HIV replicating and surviving in a host cell. The molecular method is novel and therefore is notable in the study for its usage. Let's now discuss more methods of the trial regarding diagnosis, detection, and tracking.
The POL gene nucleotides used in this research for genetic linking were gathered from the CDC PCR testing and monitoring. This data was used to help identify different strains of HIV and linked cases. Within the study, 221 days was considered to be an early diagnosis, and anything past 221 days was considered to be an established diagnosis. The study used BioRed HIV-1, HIV-2 plus OEIA to detect antibodies during the study for either HIV-1 or HIV-2 strains. The study also utilized HIV trace to track interconnections, especially with different strains of HIV, which helped aid with a visualization of contact tracing for the virus. Stakeholders were interviewed as means of identifying PWID, which also allowed for researchers to find subjects in the study. PWID were asked questions relating to sex, engagement of care, HIV status, and city of residence. The PWID were interviewed to additionally assess risks for the community, including sexual risk behavior as well as drug use behavior. Let's discuss the incidences of HIV reported in relation to the investigation that occurred by looking at Figure 1.
So the image that was used to show the incidence of HIV in relation to the investigation and response of the HIV outbreak in Massachusetts from 2015 to 2018 is currently on the slide. There was an HIV diagnosis peak from April 2017 to January of 2018. The graph also indicates when epidemiology services were extended to new cases of HIV, as well as providing services to those who were linked to IDU, as well as past or current HCV infections. The study demonstrates that 221 days post-exposure for 2016 spikes put initial exposures for those patients in June 2015. In addition, April 2017 to January 2018 were the peak diagnosis months. In June 2017, genetic sequencing began to be used to molecularly link the patients. From January 2017 to December 2017, epidemiologically linked cases were seen to have increased. So let's discuss next the cluster in cases and how HIV infections spread within the community.
This model demonstrates the contact tracing with molecular clusters and the status of those exposed. A red dot with a black outline is an HIV positive case, whereas a red dot with a black dashed outline is a non-outbreak case. Non-outbreak HIV positive case. A blue dot is an HIV negative case, and a gray dot is an unknown HIV diagnosis status. Each is noted with molecular clusters from A through I, and if listed as NML, it is not molecularly linked. NS means there is no molecular sequence available. The black lines indicate for IDU, red lines are for sexual contact, red and black lines are sexual and IDU, and gray are social contact that is unspecified. The cases below the clusters are unable to be connected to any other clusters through contacts and are categorized by the strain of HIV according to that key. As you can see, there is a clear epidemiological link to suggest sex and IDU can potentially be commonly tied, indicating they are related in HIV transmission as well. A lot of the untested unknown ends on this map, the gray dots, could lead to further positive cases that scientists may be unaware of as well, as their status is unknown. Next, let's discuss the demographics and characteristics of the studied outbreak, both epidemiologically and molecularly.
The numbers we want to highlight that are primarily affected are young, non-white Hispanic males, primarily between 20 to 29 years old. Again, this data has been taken from primarily within Lowell and Lawrence and are mostly epidemiologically linked. The peak diagnosis years are 2016 and 2017. Next, let's talk about the linkage between city and state cases over time.
From Figure 3, 2008, 2013, and 2004 are years where these cities and their linked cases increased differently than statewide cases did. Statewide cases and city cases overall increased and decreased together, indicating a correlation relationship. There is a clear upward trend in cases during 2015 to 2017 overall, as well as an upward trend in cases specific to Lowell and Lawrence. Next, let's discuss results specific to HIV subtypes as well as antibody studies.
In this population tested, HIV-1 subtype B was most common. Every subtype of HIV that was seen except for one had contained a mutation called K103N, which is an NNRT drug-resistant mutation. Specifically, it is resistant to drugs such as nevirapine and evaporins, which are reverse transcriptase inhibitors. In addition, 30 tested for antibody avidity, 17 were recent infections, defined as 221 days within the study, and the other 13 were established infections after 221 days. None were receiving antiretroviral treatment at the time of diagnosis, regardless of if they were established or recent infections. 112 unique cases were found via interviews. 54% of transmission featured needle sharing, 29% of interviewed featured both sex and needle sharing, and 17 was just sexual exposure. These interviews can help guide public health workers on creating one unified motion in preventative care in the community in terms of providing resources and educational services. Finally, 88% of people who were contacted had connection to Lowell and Lawrence. Let's discuss those who were interviewed a bit further, those who inject and the stakeholders.
The research states that those who were interviewed were aware of harm reduction measures. It also reports a large occurrence of sharing syringes and injection equipment when no other options were available. Sexual risk behavior included males and females exchanging sex for drugs. About 20% of those who inject drugs said that they inject more than 10 times a day. All of the interviewed PWID experienced homelessness within the last 12 months at the time of the interview. The stakeholders interviewed had included service providers, emergency care, healthcare providers, law enforcement, and homelessness services. They frequently discussed their sightings of fentanyl injection, homelessness, and incarceration. Let's next discuss the steps taken within this study for action in the community.
Within the study, there were 35 HIV cases that were epidemiologically linked, 26 molecularly linked HIV cases only, and 95 HIV cases that were both epidemiologically and molecularly linked. Overall, the funding for prevention, testing, and harm reduction measures to be implemented in key areas like emergency departments, homeless shelters, jails, and the general region overall was over $1.7 million. In 2019, 166 cases in total were recorded. The cases recorded in the area accounted for 52% of overall HIV cases for injection drug use statewide from 2016 through 2017. The Massachusetts Department of Public Health founded the syringe service program in 2018. So let's discuss the implications of this case then.
First, the study demonstrated that unsafe injection is often corroborated by stakeholders. The outbreak occurred in an area with long-standing opioid issues, and the stakeholders were aware of the issue. In addition, high-risk sexual behavior was often common, including not using prophylactics such as condoms. Fentanyl usage often led to a higher frequency of injection use overall due to its effects wearing off faster. We also saw an increase in HIV cases where fentanyl entered the injection drug scene in 2015, hinting that an increased injection rate correlated with fentanyl, with fentanyl also correlates with a higher infection rates overall through injection. This study brought up the discussion regarding if older syringe service programs were effective and efficient and asked what could be done to improve them. It also showed that HIV infection was diagnosed early for some, but not all patients in the study. The poor continuation of HIV care had varying reasons despite healthcare being present. In 2018, suppression of HIV virus was only achieved in 63% of the patients, and 12% did not have a viral load test within a year. However, the viral load suppression is still low compared to the state average of 79% as measured in 2015. This can have a comparative inaccuracy as years are different between 2015 and 2018, but the difference should be noted overall. Homelessness and incarceration are the main stressors for those who use drugs, and the social instability often fragments and disrupts care, frequently leading to no treatment at all. Finally, let's discuss the limitations of the study.
Some limitations for this study include the inability to review toxicology reports. This limits awareness among people who inject drugs, as well as local services who can help promote awareness for infection rate among certain drugs if toxicology reports were readily available to be studied alongside qualitative interviews. In interviews, there were no specific questions about which drugs those interviewers had used, or those interviewed had used. So this also limited the study in the same way that the lack of access to toxicology reports did. The lack of ability to generalize qualitative data meant that the cases interviewed specifically could not be generalized to other outbreaks, limiting the case to its quantitative data and to better generalize. The inability to gain data from private testing labs also limited the study, as it did not allow researchers to view and characterize HIV testing over time positively or negatively. The reports from positive cases have remained consistent from clinical labs in the state, which does mean that there is consistent testing availability, though. To conclude, what does this study give to the public?
The study states that improvement must be worked upon using a collaboration between stakeholders in the community and public health systems, especially at a national level, or no change will occur. It also urges the preemptive deployment of services like syringe service programs and harm reduction, medicated assisted treatment for opioid use disorder, targeted HIV treatment, and case management for HIV patients in injection drug communities. Here are our references, and thank you so much.